I'm speaking with Dr. JaDean Anderson. Dr. Anderson, a person who has a child with ADHD, would bringing them in for a chiropractic adjustment help?
Yes, sometimes a spinal misalignment will control whether or not their organs are functioning properly. In some cases, it's just a slight misalignment that's affecting organs, dealing with how excited a child gets or how slow and lethargic they are as well. So sometimes an adjustment, along with what in those cases we do diet modifications as well, cutting out white sugars, things like that, eating smaller meals throughout the course of the day seem to help children that have ADHD very much so.
Addressing nutritional needs, especially cutting out the white sugar,
Yep.
along with adjustments. What about medication?
Medication, that doesn't really fall in my realm for being able to recommend it or not recommend it. I look at it as starting with the least invasive form of treatment possible for the patient, and looking at medication as a last resort to be able to help your child cope with the problems.
If my grandchild appeared to have ADHD, I could start by bringing the child in for a chiropractic adjustment.
Yes, chiropractic adjustments along with the diet modifications lots of times helps the child cope with the problems of ADHD greatly. In some cases, a little bit longer term with the diet modification will in turn help. So sometimes you see rapid changes, and other times it takes a little bit longer duration for them to change and alter to the diet modification.
Well, that's exciting, because I would not have thought that a chiropractic adjustment would help with that, and possibly you could avoid medication.
Right. That's kind of how we like to approach all conditions, is starting with addressing the actual cause of the problem, and then if we can't completely fix the problem, then addressing it with medications.
Thank you, Dr. Anderson.